welcome to the CODA Cure session, where we're going to talk about one of my favourite topics in sepsis. And we're going to start off with a talk by Julie Leask. Julie is a professor in the Faculty of Medicine and Health at the University of Sydney. She's an expert on behavioural science in public health, something I would have liked to have been taught about a long time ago. Specifically vaccination uptake, programs and policy. And Julie chairs the WHO Behaviour and Social Drivers of Vaccination Working Group. So we're really, really lucky to have Julie with us today. Thanks, Julie.
Thanks very much, Simon, and it's great to be here. And I would like to acknowledge that we're on Gadigal land of the Eora Nation, pay my respects to elders past, present and future, and any First Nations people here today. So I'm going to talk about COVID-19, vaccination and medical misinformation. And I'm going to start with a story of a trip to New Zealand in 2004 with 2 small children in tow and a husband. And I approached the immigration official there at the border, and I said, he said, "So what's the purpose of your visit?" And I said, "Well, I'm speaking at a conference." And he said, "And what's the conference?" "It's an immunisation conference." "And are you for or against?" And I said, "I'm for." And he said, "All right, you can come into the country." Because we value vaccination. And that's one of the good things about vaccination when we're so concerned about hesitancy, misinformation. Let's go back to the late 40s, early 50s in Australia, where we had polio outbreaks. And if you look at the news reports then, it looks a bit similar to last year in particular. Beaches closed, schools closed, ministers acting. And once the vaccine came along, there was demand. You'd see people snaking around the blocks waiting for their vaccine. There are people who want vaccination, and there are plenty of them. COVID-19 has upended our lives in so many different ways. We've had people who had to say goodbye after 36 years of marriage, or people who have been so terribly ill. You've had your own unique experiences with it. There have been families that have been kept apart for prolonged periods, and whole economies damaged, such as smaller Pacific Island nations like this market in Samoa. And we now have vaccination, which is a good thing. And this is an image of people at the Dodgers Stadium in LA, in their cars, in the queue for the COVID-19 vaccination. So it's a little bit different to that polio queue, but it tells us the same story. People value vaccination. But we've got threats as well. Last year we saw a coalescence between anti-vaccination activists who have been around for 200 years and anti-lockdown protesters and those who believe conspiracy theories, such as that 5G is a cause of COVID. And we've had claims that vaccines are poisonous chemical cocktails that cause all manner of modern ills, that governments are intent on controlling their citizens rather than helping them through the mechanism of things like vaccination, and that it's part of even a new world order. Some believe this, not all. And for many, it's better to get back to nature and to prevent diseases naturally, such as with fresh air, sunshine, a good diet. And that includes how to prevent COVID. And if you look at vaccine acceptance and where people are at with the COVID-19 vaccination at the moment, you see that countries really do vary. So the blue line is those, when you ask them, will you have the vaccine or have you had it already? Yes. The grey line is unsure, and the pink one is no. And Thailand's doing very well with vaccine acceptance, but Poland, France, Hong Kong aren't doing so well. And what appears to be common to those countries is the issue of trust in government. So trust is at the core of vaccine acceptance. Australia, we've got, depends on how you measure it, but 64% saying yes, 23% saying not sure, 21%. I think it's 15 saying no. So we're doing okay, but we've had a little bit of a slip in confidence. What sort of things drive hesitancy about COVID-19 vaccine? Well, the National Centre for Immunisation Research and Surveillance are looking at this right now. And the literature already is showing that people are worried about safety. This is a new technology, the mRNA in particular. And they're not sure what that means for the effect of the vaccine on their bodies. They're worried about whether the vaccine will be effective enough, which is kind of a quality problem because it's the one that relates to their demand. They want the best vaccine. They're worried about the fact that it's been developed in record time. They perceive there might be risks that are unknown, and that uncertainty is troubling. They might mistrust government, pharmaceutical industry, medical professionals recommending vaccination, nurses recommending vaccination. And they may believe conspiracy theories. And that can be reasonably common at the moment. Around 9% of people believe that 5G theory, and we think that's because this is such a volatile time and people's lives have been so enormously disrupted. But on the other side of that, as you saw with those queues for vaccination, people who vaccinate feel confident in the vaccine and its safety and effectiveness. They perceive the risk of COVID to be high. They trust their healthcare professional and governments, and they have it recommended to them by a health professional. And that's where you have a potential role to play, because as healthcare professionals, you will be talking to people and they will look to you for your advice. So having the vaccine, if you're comfortable to, and also recommending it to your patients, families, your communities, those online, is powerful. It's influential. So we think of vaccine acceptance not just as a binary, you're for or against, but in terms of this spectrum. So you'll have the people who are anti-vaccination activists. They're really small, but they're vocal. And there's some of those people at the lockdown protests and the anti-vax protests. You'll have people who are intending to reject vaccination. There are those who are very hesitant. That's that unsure group. There are those who are planning to accept it, and those who want it, and they want what they perceive as the best vaccine. And they want it now. And those who are advocating for it. And there are different communication tasks with each of those groups. So you want to minimise the impact of the activists. You want to address the concerns of the hesitant, maintain good process for those who are accepting so they don't become the rejectors of tomorrow because of a bad clinic experience. And you want to manage expectations of those with high demand and support the advocacy efforts of them and advocates with good quality information tools and their own knowledge built up. This slide is interesting. It's from YouGov with Imperial College, who have been looking at global attitudes to the COVID-19 vaccine. And it shows that in each of these countries surveyed, there were a group who said, no, I'm not going to have the vaccine, as you saw earlier. But there was only a small proportion of that group who were saying, I'm against vaccines in general. And in Australia, that was 2%, whereas 15% said they're not going to have the COVID vaccine. And that 2% is similar to the figures of childhood vaccine refusal in Australia. About 2% of parents don't want their children to have a vaccine. So the people who don't want to have a COVID vaccine aren't necessarily really against vaccination in general. And that means that with good experiences and good social norming and good information and good engagement, they might shift. What about responding to misinformation? This is such a challenge at the moment, and we've of course had all the news about Facebook today, which has shifted ground in terms of access to mainstream media on Facebook. But there are some general suggestions from the literature and from communication science. When there's misinformation around, you need to know whether it's being shared, because there's a lot of it, and you don't want to waste your time responding to misinformation that nobody's really paying attention to. And it's not enough to count tweets. You have to look at whether people are sharing them or exposed to those messages. And also, is it affecting people's behaviour? So in Iran, for example, the misinformation that alcohol cures COVID caught on, and people tried to access ethanol and sometimes got methanol poisoning. That caused harm. You need to deal with that sort of misinformation. How do you deal with it? You inoculate people. You give them small doses of the opposing view of that misinformation, starting with a fact, letting them know you're going to tell them the misinformation, telling them what it is, ending with the fact. And then they're ready for when they see it in the wild. Use trusted spokespersons. The UK campaign for vaccination has Sir Michael Caine and Sir Elton John. And this is a wonderful ad. Have a look at it when you have time. In Australia, during the H1N1 pandemic in 2009 and 10, in Gomeroi country, they worked closely with leaders in Aboriginal communities, and they were the go-to people. And you then have emerging leaders during pandemics, like Sheila Basra, who was the face of calm during SARS in Toronto. Don't feed the trolls. It can be very tempting when someone says something to you that's wrong on Twitter to come back and correct them. I just did it then. But try not to get embroiled in big debates with people who aren't going to shift. You'll be wasting your time and giving them oxygen. And some people are energised by the oxygen you give them. Ask yourself what it's really about. If you have a family member or a patient, or you yourself might be hesitant, you might be concerned about the safety of a vaccine, about it, whether it works well enough, whether it's needed. Sometimes that's about other things. And for people who don't vaccinate, we've found that sometimes it's about wanting to protect oneself from a vaccine because they think they're unsafe. Sometimes they feel disgusted by the idea of having that needle with that mysterious stuff go into their body, the purity issue. There are many people who want self-determination, want to choose what they do with their bodies, and see government attempts to encourage vaccination as an imposition on their choice. There are some people who are grieving from an illness or the loss of a loved one, or they're traumatised by a bad experience with the health system, and they process that trauma through vaccination. They might blame the vaccine for the thing that happened to them. But in any case, they might say to you they don't believe in vaccines, but what they might actually be saying is, I had this awful experience. And some people who hang out in communities where vaccine refusal is common, whether it be a community or even a workplace, want to belong to that place, and so they are less likely to vaccinate because it's socially contagious to refuse vaccination. We've developed some communication pathways for health professionals around vaccination, and with a very simple sort of algorithm, if you like, that people are either ready to vaccinate, they're hesitant, or they're intending to decline. And the way you communicate with them, the time you spend, and the resources you provide to them will depend on where they're at. And so with this package at talkingaboutimmunisation.org.au, we've put together resources to help health professionals have those conversations, because a lot of health professionals don't have all the answers to the questions. The bigger picture, though, is that it's not just what people think and feel. It's not just those social influences. It's also the practical issues that influence vaccine uptake. And we can't ignore that, because sometimes the biggest enemy of high vaccination uptake is logistics and practical barriers, or a failure of systems to reach all people equitably. And it's interesting when you look at the evidence on what improves vaccination rates, it signals that these actually might be quite significant things. So, you can't just educate people about the importance of vaccination. Alone, that doesn't work. You need to make services convenient. On-site vaccination improves vaccination rates. Incentives do. Of course, free vaccines do. Institutional recommendations are influential. Reminder and recall, provider recommendations, champions, and so forth. And in this image at the top, you see vaccines being made available through Salisbury Cathedral, which also signified a religious stamp of approval for the vaccine program, which was symbolically important too. I want to leave you with this image. This is the Blue Mountains, and it shows the devastation of the bushfires at the end of 2019, early 2020. And in some ways, it is a little bit like the devastation that we've had from the pandemic, for some people at least, and some countries. But after these sorts of things, there's always renewal. And I think vaccines are going to be one thing that helps us, not the only thing, but one of the things that helps us to try to get back to some semblance of what life was like before, albeit with new COVID-safe practices around that. And so when we're talking about vaccine hesitancy, a lot of the focus is on safety, but it's always important to remind people of what vaccines are about, because that's what they value. So, leaving you with this image, keep calm and carry on vaccinating, or keep calm and be vaccinated. Thank you.
Many thanks, Julie. So we saw some figures there, which is interesting. So I'm going to just ask the audience's opinion of this issue, because I've certainly had non-medical friends who I consider to be well-informed and intelligent ask me whether I think the vaccine's safe. So if we had a pot of vaccines up here on the stage with us, could you put up your hand if you'd be forming a queue here to have it? And I think we've got enough to go round. Anyone who would be concerned and would not want to come up and have the vaccine? Don't everyone look round to make people feel bad. So at least one person is brave enough to put their hand up. There are a few abstainers, because I did see a few people didn't put their hand up at all. And Nick, I mean, many of us will have watched Q&A, and obviously you've been very engaged in vaccine discussions within the heart of the federal government. Are any of these concerns real? Are you going to get vaccinated?
I think the thing that I've noticed about the debate is that there are all the concerns are legitimate. As Julie said, we're not talking about people who are activist anti-vaxxers here. But the thing that's been most troubling for me, I think, is the importance of getting the medical profession as a whole united behind the vaccination program, and in particular some of the discord around this, we're calling it the dueling vaccines narrative, the Pfizer versus AstraZeneca. And I think that the Q&A episode, if you saw it, illustrated that quite nicely. It's perhaps worth a look. But I think, you know, if we're all going to be honest with each other, both people who believe in the strategy that we've got, which is Pfizer and AZ, or take the view that there's an issue with AstraZeneca, both sides need to say, we simply don't know, because they haven't been compared head to head for their ability to, for their efficacy. The trials were different, but also the outcome measures for severe disease, that neither study was powered for that. So we're going to rely on the real-world data more than the phase 3 trials, and the real-world data is starting to be compelling. And I think what we're all going to see is that gap between the two vaccines narrow, but most importantly, that they're both going to be protective from severe disease and hospitalisation, and that's going to protect us and our health system.
Right. And Vera, you've worked with a lot of disadvantaged communities, and we've seen that COVID-19 has disproportionately affected such communities around the world in terms of severity of disease, mortality rates, etc. Do you think there's a risk that those people who are probably most at need are going to be left at the bottom of the heap? Or are there communities where it's going to be culturally unacceptable that we'll have to get into?
I think the question of equity is a very important one, and the complex answer to that is yes and no. So, for example, in Australia, we have a science-based vaccine campaign that's going to be rolled out. The people in need are going to get it first. And in many high-resource and or other countries who are getting it right are doing the same. Globally, however, nobody is thinking on a global level. I think we'll get to WHO and so on later, but we do not have the conductor to have a global response. So once again, yes, there are issues of countries where it's particularly badly managed at the moment, sometimes because of the politics, sometimes because of resources there. They will once again be amongst the last to get the vaccine and also have fewer infrastructures to deliver the vaccine appropriately, which will then have the compounded issue of them remaining in a potentially financially devastated state for longer, and also be the petri dishes for mutant variants as well. So I think if we take it from a national level, a lot of countries are getting it right. The most in need will get it first because it makes public health sense and also political sense. But globally, we're lacking that. And 85% of low and middle income countries aren't even considering the possibility of vaccination. They're getting to it, but the reality is quite far away. In terms of cultural issues with vaccination, I mean, Julie has spoken beautifully about vaccine hesitancy, which is fantastic. Thank you, very educational. So if you're famous like you, Nick, roll up your sleeve and get a jab, you know, and be on TV and that sort of thing, because it really does help, and I think we should all do that. But the reality is this, and this does have a humanitarian context. So last year, The Lancet put out a paper about the reasons for vaccine hesitancy. The WHO has released a comment saying that vaccine hesitancy, or people going away from them on an international level, is going to be one of the top 10 public health issues in the decades to come. So, and we know that generally speaking, high-income countries' education, trust in government, and so on, means that you're going to have good vaccine uptake. The correlations of poor vaccine uptake include minority groups, include religious minorities and ethnic minorities, and also groups of religious radicalism as well. Because when you are in a minority group, clearly something that gets jabbed into your arm could be anything. To sterilize you, it could be to make sure that you become ill or any such thing, which is very politically loaded. But actually, there are a lot of legitimate reasons why people have stepped away from vaccines. So starting with our own sort of Western outlook about autism and immunization, the paper that came out in The Lancet, Wakefield 98, that's been dispelled, but that's created a lot of ongoing debate about autism and immunization. And also in the Philippines, they had a big problem with the dengue vaccine a couple of years ago, where if you gave kids the vaccine that had not previously been exposed to dengue, the first time they get it, they were at higher risk of death than kids who were not immunized. So that has, for some time, devastated the immunization uptake in the Philippines, and similar issues with HPV vaccine in Japan. So there are real issues why people go, oh, I'm quite scared of vaccines. And mRNA vaccines is a whole new world. It's incredible that we're using our own genetic equipment to produce the particle that we immunize ourselves against. I mean, it's mind-bogglingly brilliant, but it's also a little bit scary for many people. Then you've got the political reasons. For example, President Bolsonaro of Brazil saying, I'm not having the vaccine. You know, you can turn into a crocodile if it makes you speak like a woman, your own problem. And there are lots of political reasons why people don't want to poo-poo it. They don't have the resources to roll out the vaccine. They want to look like strong men or strong women in a political situation that is already devastated and volatile. And also in the humanitarian...
cut in a minute.
Sorry. I'm sorry, okay. I'll leave it at that. And one final thing I do want to say, the humanitarian setting, the immunization
more than
team...
me, that's very worrying.
Did go to Afghanistan or Pakistan when we hunted down bin Laden, and they masqueraded as a polio team, which has created havoc, particularly in the Islamic world. Anyway, I'll shut up
I
there.
just wanted to quickly come to Carrie. Does the CEC, the Clinical Excellence Commission, or other like organisations have any role to play in this, in terms of vaccine acceptance or the safety of vaccines?
I mean, the short answer is yes, and I know you're kind of looking at time, but there's a couple of issues that for us have got our focus at the moment. So the first is obviously people's need to get education, to get guidance and protocols, and we're working closely with Commonwealth colleagues to think about the best way to get that to clinicians quickly. And people do like to have some educational materials at hand. I think a number of clinicians are also keen to try some simulation activities about workflow and workflow processes, how we're going to get through the scale of what we need to do and what does that look like every single day. Similar to our everyday measuring of adverse events, we'll be really keen to see what that trend looks like when we get the reporting of adverse events through the hubs and through our general practice colleagues to see what we can learn in real time. And I think the fourth thing for me would be what we've learned from COVID, which is this whole piece on psychological safety for staff. And one of the things we've learned is the need to listen. And so, you know, staff are coming back to us at the moment with questions. You know, what do I do if someone just turns up at a hub? You know, how do I talk to somebody from my community and what's the best way to support them? So there's lots of questions I think we just need to be really open and transparent about answering in that way. That's all safety.
I'd like to touch on one other thing which comes out of Q&A, because I was sitting watching it with my wife, and you said, and everyone seemed to say that COVID vaccination shouldn't be compulsory, and that was whatever. And she turned to me and said, don't you have to have the flu vaccine because you work in intensive care? And certainly we do. That was my understanding. And what's the difference? Why do I have to have the flu vaccination because I work in intensive care and it's compulsory, but we shouldn't make COVID vaccination compulsory?
I'd actually be really interested to hear Julie's view on this, but I'm just going to 30 seconds.
Yeah, we'll give you 30 seconds each.
It's not
an easy question.
It's not uniform across all healthcare institutions. The concerns about the COVID-19 vaccine, I think, are real. We've seen the stats, and we need to answer those questions rather than making it mandatory. And the third thing is that as an institution, even if you don't make it mandatory or you don't take the person out of that work environment, which I don't think we should do, if there were a COVID outbreak, you may have a workplace health and safety obligation for that person not to be in that environment. So it doesn't exclude that course of action, but I think as a message, that's the one we should be promoting.
Yeah, requirements come in many shapes and sizes, and we may have requirements for COVID-19 vaccination in future in certain settings where it's proportionate to the risk and where there are good ways of managing people who won't vaccinate or can't have the vaccine. But it's far too early to be requiring it yet because we need more data on the rollout of the program, its capacity to, at what level it will prevent transmission to others, because that's essentially why you mandate.
Yeah.
And we need to build public confidence with good information before we have to go that extra mile potentially. But of course, you know, this will be a changing landscape.
I guess that my reflection of the last year is that constant change is you know, and although we had virtually no, and I feel, I keep telling my friends overseas, and I know we have an international organization, as someone in Australia, I feel, and especially working in critical care, I feel fortunate and guilty in equal measure when I know what people in the rest of the world are dealing with, and we have been extraordinarily lucky.